And for more on this, we're now joined by South Africa's Health and Allied Workers Indaba Trade Union President, Rich Sicina, and he joins us via our video link. Rich, thank you so much for joining us here on the late edition. Of course, you have raised your concerns when it comes to those austerity measures. Maybe if you can just tell us what will be the immediate impact here on the healthcare sector should the budget be cut for the healthcare sector?
Thank you, my leader, for inviting us, and good evening to our viewers at home and your team there in studio. You know what? At the moment as we speak, we used to say as Health and Allied Workers in our trade union, our healthcare system, public healthcare system in particular, is in ICU. Now it's no longer in ICU, on its way from ICU straight to the cemetery, because on the ground where things are happening, I am a professional nurse myself who is actually doing bedside nursing. Tomorrow I'm going to work, and what we are experiencing on the ground, it's shocking. What's going to happen is that the patients are still going to continue to die prematurely. The negative attitude that the community is always talking about is not going to come to an end anytime soon, because nurses, doctors, majority of healthcare workers on the ground are frustrated, and we are going to work, my sister, and in our line of duty, we run like headless chickens. There's no basic stuff. We always talk about three things that are actually killing our healthcare system: gross shortage of staff, gross shortage of material resources, and dilapidated buildings. There's like severe dysfunctionality in our line of duty. There's no GOS, there's no jail cop. These short lines, things that we use when we are putting IV lines, there's no IV line. My leader, when you come into our facilities and you are dehydrated, and we need to correct that particular dehydration and give you IV fluids, we are actually going to delay in correcting that dehydration, because there's nothing to actually dress the wounds. It takes so much for us to do basic stuff in our line of duty. So we are actually saying we are condemning this as Health and Allied Workers in Indaba Trade Union, because it simply means, it shows that that department and those in positions of authority, National Treasury and his team, they are just displaying an I don't care attitude. This move is very insensitive and heartless. It's not nice on the ground.
And Rich, one thing that always comes out from the healthcare sector is indeed the issue of capacity. And, should we see these budget cuts for the healthcare sector when it comes to, trying to deliver services? You've just painted a very bleak picture of what the current status of our hospitals and clinics looks like. Surely it will even, damage the healthcare sector even more, where we see that, you won't be able to deliver services to the people of South Africa.
You know what, my leader, I usually say maybe at some point we need not only, and we are grateful for this, actually the opportunity, but we actually need to sit around the table and actually tell the public when we say gross shortage of staff, when we say government hire more nurses, hire more doctors, hire more allied workers and general workers, and actually use our public healthcare system to decrease the unemployment rate in South Africa, and actually curb all these social ills that are happening as a result of unemployment. What is actually going to happen now? People are actually, I usually make an example. I like it when I'm drawing people into the ward, to say, come into the ward, come into a 32-bedded ward. And this 32-bedded ward, my leader, has actually, it's full to the capacity, and only 3 nurses are on duty. Only 3 nurses are on duty. Obviously, those patients, some of them need to be changed 2 hourly. We are not going to do that. It doesn't happen. Patients develop bed sores, and as a result, the department is sued. Other patients are actually, we're going to be given a chance we were actually going to resuscitate them if we are able to notice early that their condition is deteriorating. But
Yeah.
how do you notice a patient, or how do you do it? It's so that is why I usually say it affects us psychologically. It kills us spiritually, emotionally, and otherwise. It's not nice. That is why there's so much disgruntlement on the ground. It's crazy stuff. And the community on the ground, those who are recipients of the public health system are still going to suffer.
Yeah. And, you know, Rich, government always talks about the implementation of the NHI. You know, should we see these budget cuts, what will it mean for the NHI?
Our perspective, in as far as NHI is concerned, obviously we believe NHI needs to come. The NHI needs to come. We don't have to fix this dysfunctional healthcare system for NHI to come into the picture. Let NHI come, because our belief is that this two-tier system is actually the one that is actually killing our public healthcare system, because we have private and public sector in South Africa. So public sector, those who are recipients of public sector are poor people, people who are getting poverty level salaries, salaries where they are working, people who are actually illiterate and stuff like that. But if you bring NHI into the picture, it will mean all of us, me, you, everyone, whether we are in Stellenbosch or we are in Fourways or we are in Alexandra or Mlazi, we will all be the recipient of one public healthcare system. So when things go wrong, all of us, the entire South Africa, will rise and say no to nonsense, no to substandard way of doing things, no to mediocre. We need NHI. Now we are divided. Those who have the voice, who are educated, who actually can come up with solutions to these problems, are not the beneficiaries of our public healthcare system. They are the beneficiaries of private healthcare sector. So whatever is happening in the public healthcare system, it doesn't get to be talked about by those who can actually articulate our problems on the ground.
And Rich, what will you be doing to ensure that government hears your pleas with them when it comes to this, budget cuts in, the healthcare sector?
Because we started last month with Department of Health in Limpopo, it's not that Department of Health in Limpopo is in tatters alone. KZN as well is in a complete mess. Systems managers are sleeping on duty here. Gauteng is in tatters, Northwest and Eastern Cape as well. It's West Eastern Cape. So actually what we are doing now at the moment, because we've realized that our biggest problem as healthcare workers in particular, we make noise in our corridors, we make noise in those cubicles, and actually displace our anger to patients. As a result, that is why there's so much anger between patients and nurses in particular. So we are actually embarking on a journey to actually educate our members on the ground on filing grievances. And we had a march to Department of Health in Limpopo. We are planning another march in Department of Health in KZN and in Northwest and Free State. That's what we are going to say, at least to send a message across to say we are really tired.
All right then, Rich Sicina, thank you so much for your time. That is Rich Sicina, the president of SA's Health and Allied Workers Indaba Trade Union.